Hey everyone, in this episode, myself, Maya, and Dr. Tambini, we discuss gender-specific treatment, the pros and the cons. Full transparency though, we do go a little off the rails and we get into some discussion that may or may not pertain to the specific topic, but we do laugh a lot. It is a fun episode, but we do discuss, the pros and the cons of gender-specific treatment for your substance abuse, or if you have somebody in your life that needs treatment, you'll be able to navigate if it makes sense for them. So in the end, if you have any comments, questions, or concerns, you can always reach us, info@realrecoverytalk.com. Enjoy the show. Here we are, Real Recovery Talk. I am your host, Tom Conrad. In today's episode, we've got Maya.
Hi.
And we also have Dr. T.
Hello.
First things first, thank you for tuning in on the podcast app, whichever one that you choose to use, and thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message, right, ladies?
Absolutely.
You're correct.
I just swallowed my gum. I was like, I can't get up and spit it out. That was not comfortable.
It's going to get stuck in your butthole.
No, it's not, Dr. T.
You're
Don't
gonna
tell
blow
me that
bubbles.
lie.
You're going to blow bubbles.
That's what my dad used to tell me when I
Yeah,
was
it's going to
little.
take 7 years. Okay, sorry.
We're professionals, I
I
swear.
am a professional.
Every episode, something happens like this, and I'm not editing this out.
Yeah, well, that's fine. It's what I mean. Everyone heard me calling myself a bitch the time you didn't edit that out. So
Yeah.
it's
All right. Well, can I proceed?
you may.
Yes.
All right. So also want to let you know you can go to realrecoverytalk.com/guide. And there you are going to find a PDF, download. All you have to do is put your email in. 5 steps to get your loved one the help that they need. So make sure you go there, realrecoverytalk.com/guide. All right. Here we are. How we doing? Good? Everything good?
Excellent. Yeah. Can you hear me?
You got all your sessions done for today?
I did. And I'm caught up on my notes because I'm now utilizing the AI note taker.
Which is called?
Blueprint. Are we?
Shout out to Blueprint. Blueprint
Yeah.
making note-taking easy on all therapists out there in the world. If you haven't experienced Blueprint, make sure you go and check them out. They're going to make your life so much easier when it comes to documentation on your note-taking. And honestly, I think it's
It's a beautiful thing.
Yeah.
'Cause now I have time to do this instead of,
And we're not sponsored by them.
we are not sponsored, but we
Maybe we
probably
should be.
be.
Yeah.
That'd be great.
Yeah, let's reach out to them.
Okay.
In today's episode, we're going to talk about something that I don't think we've ever discussed before, and should be pretty interesting. And we brought Maya on because she's well versed in this, and so we're talking about gender-specific treatment and the pros and the cons. So Maya, to be honest with you, I'm not well versed in this. Any experience that I have with treatment has been treating both men and women simultaneously.
Co-ed.
Co-ed, yep.
Yeah.
Obviously, housed completely separate, all the typical, should be typical. There are some treatment centers out there that do co-ed and actually let them live together, which is absolutely disgusting. I don't know why they do that.
Yeah.
Other than they just don't give a shit about treatment and it's a money grab. But outside of that, I know there's pros and cons to it, but we wanted to dig into this a little bit. So anything that you guys want to discuss before we move on?
No, we can move on.
So we have a list of some pros and cons that we jotted down, and my memory as I'm getting older, I think I need some ginkgo biloba or some CoQ10.
Okay.
Or some nootropics or something, because something's going on with my memory.
Yeah.
I don't know what it is.
It's called stress.
Stress?
Hypochondriasis.
What?
Hypochondriasis.
What's that?
What is that?
Hypochondriasis.
You're hypochondriac, Thomas
Oh,
Conrad.
yes. Well, that's true.
Both of you.
Good one, Dr. T.
Yeah.
This is so
But
true.
the last episode, you were saying your nootropics were like on fire.
They were at that episode, but this one I'm feeling a little foggy.
How was your caffeine intake today?
I have my coffee over there, actually. I should go grab it. Yeah, let me go get that real quick.
Your ADHD is on fire today.
Yeah, well, that's the thing. If he's probably doing too many things at one time.
Yeah, and he's tired, so your ADHD is worse because you're tired.
Yeah. Speaking of gender,
Definitely.
the male is inferior to to the female species when it comes to multitasking and stress management.
Agreed.
Isn't that true, Dr. Tammy?
I think so. Evolutionary speaking, yes.
You think that men are inferior when it comes to multitasking?
Absolutely.
I don't agree.
I do. But we can do another podcast on that.
Okay.
Yes.
Yeah. Okay.
All right, so we have some pros and cons here, and the first pro is going to be targeted interventions. Tambini, what did you mean by that?
So targeted intervention, specifically if you want to talk about trauma. So men and women aside, each comes with their own set of trauma. And sometimes men are not comfortable speaking about that type of thing in front of women because of societal norms or whatever that might be, and vice versa. Some women have extensive trauma that may relate back to family members or friends or whoever it is that they may not even feel safe being in the same room or being vulnerable to men. So, that's one aspect of it, definitely. But I think domestic violence is another big one with women and men, to both sides of it. Men, again, may not want to speak about domestic violence. And women who have domestic violence, it may be difficult for them to be vulnerable and process and things like that around men.
Right. Maya, anything to add to that?
I agree. I agree that certainly not in every scenario, in every situation, but just in my experience as a therapist, when we're talking about traumas, and especially like Dr. Tambini was kind of touching on with specific like sexual abuse, stuff like that, I tend to see that it's easier for both genders actually to process that in a group setting when the opposite sex isn't present. And I'm just thinking like as we're like talking about this, and it's, we do gender groups here. And when we do split the group into the men and the women, it seems to be the kind of a consensus and the clients reporting that they felt more safe and comfortable to be vulnerable. Not to say it doesn't happen in the co-ed setting and co-ed groups, because it does. But it's nice for them to have that option of, doing both, kind of either or.
One thing that's not on our list, and I just want to bring this up now before I forget, because God knows I will. When people are getting clean and sober, especially young adults, there's two things that we always say, generally speaking, lead to relapse. The two most common things, and it's going to be sexual relations in some capacity and money. Those are, because when we get clean and sober, we're oftentimes looking for something to fill that void. And the two closest things to in terms of like a dopamine hit is going to be making money and having sex. And so a huge pro of gender specific treatment are to keep people separated. If, a man or a young adult male has sexual problems and is very promiscuous or, even predatorial, we've seen that in cases, and the same goes for females. Yeah. Females, especially if they are, and Maya, I'd like you to dig into this a little bit. It's been my experience now, obviously working in the field, that a lot of women that have sexual trauma in the past, in their childhood, tend to act out sexually more. They're more active on a sexual level. And another good
that
reason,
can be the case.
Another good reason why, gender specific treatment would be good for them.
Yeah, I agree. And you're right. Like, I'm glad you're touching on that, because it's the idea being like, let's just separate, keep them separate. And it's kind of like temptation reduction, essentially. It's kind of like, the same idea of like not going into a bar when you're trying to stay sober. Same idea, because you're right. It does become like a drug for them. And remember, they're experiencing like really uncomfortable feelings in early recovery, between even just the neurochemistry that's happening in their brain with massive amounts of stress hormones pumping through them because they don't have their drug, their substance of abuse. So their dopamine levels, endorphin levels, serotonin levels are below even what would be considered like normal range. And the brain is producing more cortisone and stuff like that. And so they'll kind of grasp at anything to stave off those kind of negative experiences that they're having. So, like you said, sex is great, shopping's great, food's great. Ultimately anything can become utilized in an addictive manner, ultimately, when you think about it. But yeah, like you said, relationships are like the go-to, because it gives them that endorphin high, the connection, the love, the validation, that kind of thing.
Yeah, we always hear about the rehab romances, and it's always laughable. And I experienced this, and I've shared this on the podcast. I won't share the whole story, but I met a girl in detox, and I thought she was going to be my forever, and we had this whole plan, or what I thought. I had this plan. I don't think she did, but I did.
She didn't know about the plan.
That we were going to just sail off into the sunset and everything was going to be hunky dory. But turned out the plan didn't happen, obviously. But the one thing that I will say is that this plan was so real in my head that I was almost when the plan didn't go through and she basically just ghosted me, the emotions that I felt, thank God I was in like a safe and secure place. I was in an aftercare program at the time, because that was the first time that I really felt like I'm reluctant to say heartbreak, because I wasn't in love. I was just like, I was delusional at the time.
Look at it from Thomas now, from your vantage point, but Thomas back then in that moment was heartbroken.
Yeah, I was sad. I was like, oh man,
abandoned.
Yes.
And
that's what do you always say to the clients when you do your group? Thomas does a group on
what's the Thomas? Why do you call me Thomas?
Because it sounds very good. I like it. It's a nice solid name.
Okay.
But so the group where you ask the clients, are you the person?
Am I the person that I am looking for is looking for?
Right. And it's, oftentimes, man, because really, ultimately, when you take away the substances of abuse, those weren't their problem. That was their solution, right? And underneath that solution is the diminished sense of self, the low self-worth, the negative core belief system, the I'm not good enough, I'm not worthy of love, I'm not lovable, I'm a bad person, those types of things. And it's typically the way we view ourselves and our core belief system that directly impacts who we end up attracting into our world and letting into our lives. And certainly our clients that are early in recovery have no concept of what a healthy relationship, most of them, looks like. I mean, or setting boundaries or any of that stuff. So it can be a total, just nightmare, you know?
Yeah. All right. Well, moving on to a couple more pros, comfort and safety and reduced distractions. Let's dig into that a little bit. Go ahead, T.
I would say that would lead more towards peer support, women supporting women, men supporting men. Not always, that's not necessarily always the case, but I do find when you do gender groups, like you said, it typically is like a smaller environment. people tend to be more open and willing and vulnerable with those things. And then after, you start to see like friendships develop and people of the same genders gravitate towards one another. And oftentimes, even one of our clients here last night said to me, I actually really like it because there's people here that are my age, my gender, similar backgrounds, similar problems as me, that I can relate to, that I can talk to, I can speak open and freely and not be judged because it's like their life mirrored mine. And I didn't know that people out there struggled the way I did. And it was good to hear because it was eye-opening for him. And it's good to see that he's now being more open and willing with where he's at.
Yeah.
Beautiful.
So,
Well, I tell people all the time when they come in, we're all unique in the sense like our situations are unique, but we're all cut from the same cloth. You know, if you're sitting in one of our seats or any seat in treatment, you didn't just wake up one day and decide you were wanted to go to treatment. You kind of worked your way there. And anybody else, you know, sitting to your left and sitting to your right, situations are different, unique in a sense, but still the same common denominators. And being able to identify those. And actually, like, I love that peer support thing because that I think is something that a lot of times people breeze over is actually the support that's offered within treatment, within Alcoholics Anonymous, Narcotics Anonymous, any sort of support program, Celebrate Recovery, the peer support and the community aspect. And I harp on this all the time on the podcast. I think that's one of the biggest missing pieces.
Yeah, because 100%, without a shadow of a doubt, in my opinion, connection and a sense of belonging, like true belonging, is the opposite of addiction. It's not abstinence. I promise what they were chasing all along is that instinctual drive to be a part of a tribe. That's actually a survival mechanism for us because for thousands of years, we didn't live in modern society like this, in buildings and all of that. We lived out in the wild. And we had to live in communities in order to survive. You weren't going to survive long out there on your own. You just weren't. And your brain is actually hardwired for connection. I think it's probably one of the reasons that as a generation, we're probably the most medicated, depressed, addicted, overweight. And yet we have the most luxuries and conveniences and comforts offered to any generation ever. So explain that, right? And I think it's because what we've done is set up a world in which we can be individuals and we can be isolated and still survive in terms of, you know, getting food and having shelter and all of that stuff. But we're missing that true sense of belonging that is a core need for human beings.
Yeah. So,
and I mean, that could be a whole nother podcast, but yeah. So I think to have that is so important.
There was, and I didn't read the article, and everybody knows I'm an avid listener of Mind Pump. They were talking about,
shout out Mind Pump
again. Yeah.
Yeah.
Sal or Adam, or one of them was talking about an article that they read or something they saw that there was this, I don't know if it was an African tribe or it was some sort of tribe. They live in the woods, whatever, yada, yada. They got introduced to the internet. And I don't know if it was through Starlink or what, but they were offered internet access. And I guess the tribe took a vote and they opted to try this whole internet thing out for a period of time. And in 6 months, they said, nope, we're done with this. Because they came out and said that the young men, the young women, they got introduced to pornography. They said that it absolutely wreaked havoc on the culture, you know, and the way that they did things. And, you know, to us, we're like, we couldn't imagine our lives without it. And they're like, we can't imagine having this in our lives anymore.
Well, you can if you think back to childhood. So think about your childhood. We didn't have.
Huh?
Stop biting your fingers.
So I can't.
Yeah.
I'm sorry.
So we didn't have it growing up. You didn't have it. You didn't have internet growing up. And I had a blast, man. I was out making tree forts and building things. There was that one time I set the woods on fire, but
I think we've all done that.
I think I even learned from that. I think I had to write like 1,000 times, I will not play with fire. That was like my punishment. You know what I mean? But I mean, I was exploring, and I'll tell you, thank God. I look back at that and I'm like, thank God I didn't grow up in front of a screen. Because man, and you'll see like our younger generations, our younger clients that come in, their psychosocial skills are like next to nothing. And yeah, of course they're in a substance use treatment facility, so of course substances of abuse are going to stunt psychosocial development. But it's like to an exponential like level, in my opinion, and it's because they're not out interacting.
And they're exposed to substances younger and younger now because of access to internet, and
they're like ordering drugs
online
on like the black web or whatever,
on the dark web, and it's getting delivered to their home, and their parents are not aware. It's coming in the mail, and they're sharing it with their friends. So imagine what it's doing to their brain. Earlier and earlier.
Well, I'm starting to read things that are talking about how it's impacting their frustration tolerance, patience, ability to focus. I mean, you name it.
Oh, that's a real thing. I mean, so we have iPads, and we only use the iPads in very specific situations.
Yeah.
If we're going on a road trip, like, I don't care. Like, look at me however you want, say whatever you want. If I'm in the car for over an hour, they're getting an iPad.
Yeah.
But you can see the physical difference from when, like, if we go to Orlando a lot, and that's about a 2.5 hour drive. For sure, that night or the rest of the day, my kids are absolute nightmares.
Yeah.
To where if they weren't on the iPads and like, we're at home and, we have the swimming pool, we have property, they're outside playing in the dirt, doing whatever, they're fine the whole entire day. But, as soon as they get in front of screens, forget it. There's something there. I don't know what. But again, another topic for another podcast. So a couple more on the pros. Obviously, there's a lot of pros. We covered the peer support, comfort and safety. You're within your own gender. Targeted interventions. I like that. You can be a little bit more open and honest about specific traumas, domestic violence, stuff like that. Limit the amount of temptation when it comes to sexual interactions or just even relationships, having a female or vice versa. Just the temptation there can be tough for people when you're early in sobriety. And
I was just thinking as you were saying too, I think it's good for them because a lot of recovering addicts during active addiction really kind of strayed away from platonic relationships, certainly. And a lot of times the romantic relationships were either, like we have that saying, like I took hostages kind of thing, meaning like they were very unhealthy types of situations. I know, especially for the females, you'll hear them say things like, I don't trust women. I didn't trust women. I didn't have relationships with women. And I think it was because there was some level of them that felt vulnerable with women because they didn't feel good enough and they were dealing with a diminished sense of self, et cetera. And then B, there's the component of like they probably were able to engage in more of the manipulation and stuff like that they would during active addiction with the opposite sex because there's that sexual piece that allows them to be manipulative, et cetera. So I hear that a lot too. So it's a good segue into them really starting to establish some healthy platonic same-sex relationships, which are really important in recovery. And they can start to get their feet wet with learning how to, have those types of relationships and talk to women and be vulnerable with women. That was my own personal experience. I didn't have any friendships. I mean, any relationships, you know what I mean? So, and certainly not with many women. So like my sponsor and the women I was in treatment with were kind of my segue into learning how to do that.
You see that a lot in treatment. People, you more see it with well, I don't know. What I was going to say is you know, you have the guys that say, I don't really get along with guys.
Yep.
I get along with girls. And I don't know if this is okay to say. I think it's okay to say.
I'll let you know if it's not PC.
Okay. I think it's more like with gay guys.
Yeah.
You know, they get along with women more.
Yeah.
And if I see a guy that I know isn't gay and tries telling me like, oh, I get along with women more, I always get like the red flag, like, no, I think you're probably trying to get laid, you know? But with females, I've noticed that it's more like females, if they legit say I get along with guys more, I don't automatically go to, oh, you must be a lesbian. You know what I mean? Like, it's like, I think you probably legit may feel that way. Doesn't make it right.
Right.
You definitely need to work on why you don't get along with females and kind of unpack that.
Well, yeah. And I think, and you're probably definitely making some assumptions. And
I think that goes back to societal norms, gender role
and that's
expectations.
Okay, because every human being has them, and you know, and
oh, we haven't even gotten to the.
But I think it
the good parts yet.
Yeah, I think it is like a varied type of thing. But I will say, like, and I'm speaking more from my own personal experience in being in active addiction and being in that lifestyle. And going through all of that I went through, like, and being around, I mean, just a ton of other recovering addicts, both when I was in treatment and going through my process, and now on the flip side of that, as a therapist working in treatment with my clients. So it does tend to be like this common thing.
But did you get? Let me ask you: did you get along more with men or with women? Because I'll be on. I picture you as somebody that would get along with men before women.
Well, yeah. So that was, yes, that was true of me.
I personally think that, like, and this is a societal or a cultural type assumption that women oftentimes don't like women.
Yes,
it's, you know, we see that in our
like
sober
a lot
living,
of, like, pettiness and cattiness.
Right.
I've found that the more I've worked on my self-worth and really learning to love myself and come into myself, and also my spiritual practice has taught me to just love everybody. You know what I mean, and to embrace everybody, and also, but it is a big piece of it was my self-worth work that I've done on really just cultivating that sense of self-worth. And now I don't feel less than around other women. And, you know, because it was like that comparison thing that happens with us, which is a natural tendency that human beings have. And I mean, addicts or not, comparison is common. If you
Even
talk
with
to
men, you guys size each other up all the time.
Yeah.
not near as much as women do. I do not agree.
That's not a fair
argue.
statement. Yeah.
I'm married to someone like that.
Yes.
Pierre?
Yeah. Yes.
What do you
Yeah.
mean? Like
He's always sizing up other men.
We're going to have to archive this podcast.
Always. But I think that ultimately comes back to his own insecurities.
I agree with
Because he is
that.
a definite
Yeah.
alpha male, but
He's
deep down inside, I don't think he is.
Well, right, and a lot of times, because I'm an alpha female,
I am as
But a
well.
lot of that, my confidence and like my very my assertiveness that I have was at times in my life a cover for my diminished sense of self. You know, I'm like, oh well, I can just scare everyone, intimidate everyone, and be smarter than everybody else, and I'll be okay. Nobody will really know that I'm not good enough.
Right.
Kind of.
I
thing.
agree with that, but I think on an overall assumption is that, and I have no data to back this up other than
Disclaimer.
all I know is that we have female housing and we have male housing.
Yeah.
And there's far more issues in terms of mean girl shit inside the female house than there is the guy house.
That's a valid assessment, Thomas. I'll
so I
agree.
do have data to back it up.
Yeah, I mean, you don't have actual data, you know.
Well, not that I wrote down with pen and paper.
But I'll be honest.
We have incident reports, though.
Yeah, that's
yeah.
true.
And this last,
Yeah.
Yeah.
No, that's a valid statement. I can't disagree.
What were you going to say?
But my honest bias here is that I've only worked with male-only treatment facilities or co-ed facilities. I've never wanted to work with female only facilities because I find, again, that I think that goes back to
I don't think you have the patience for it.
I agree. And I think I am more like a guy in terms of my emotions, how I handle things. And so it's hard for me with women to let that guard down and to be like, to be more open and understanding and trying to help
because
them.
Generally women cause more problems.
Well, that's been
not
her.
what goes
I
through my
actually
head.
like that we're doing this podcast and that we're all getting really vulnerable right now because it's the reality. We all, and every human being that's watching this is going to be able to relate to this in some way, shape, or form because we're all going. We're kind of borderline, like not PC right now with this conversation. But the reality is these are the thoughts we have. And you know what? It is good to talk about this stuff. And yes, in my experience with the female versus the male clients, there tends to be, let's say, more like arguments and disagreements in housing and stuff like that. And who knows what that's rooted in, based in. Is it because the women are more emotionally unstable? Who knows? I mean, we could sit here and you know, but at the end of the day, you know, it is really a valuable thing for them to learn how to have healthy same-sex platonic relationships. So this is a perfect platform for them. And anytime they're having disagreements in house, what do we tell them? This is a great opportunity to work on conflict resolution skills and boundary setting and communication skills, et cetera, right?
Well, it's kind of what it's designed to do.
Yeah.
You know, you're not going to go into a sober living environment and not have issues.
Absolutely.
Anywhere you go. All right, so let's get into some of the cons. We covered all the pros, and there's obviously more, but some of the cons, we have reinforcement of stereotypes. What do you mean by that, Tambini?
Kind of what we just talked about.
Okay.
You know, I think it could be a good or a bad thing either way. It could be a pro and a con because, like you said, there's certain treatment facilities who allow co-ed living versus only facilities I work with only allow gender-specific housing, which, again, because of the things we talked about prior, are good things. But the bad things that come along are, and I'll go to the male side of this, not as a generalization, but sometimes I don't want to say they're institutionalized, but if you have patients who've been in prison or in jail or have been in and out of treatment for a long period of time who are used to living in a group environment like that, you start to see things, people stealing food, kind of like a hierarchy within the males, like an alpha male, and then everyone that falls beneath them. And you start seeing these societal changes even within a small home that you have to kind of go in and break it up and say, all right, we have to split some people up here because things are not going the way they need to go.
Yeah.
There's, you know, obviously with us, we have housing for both men and for women, and
Separate.
Yeah.
Yeah.
One of the issue, and it wasn't even an issue, but it was something that could have become an issue. And again, you have to understand that what we do, we have people that literally come in from across the country. Yeah. And whether you're from California, you know, New York, backwoods Virginia, Alabama, all these pockets of different, you know, societal norms and cultures and, you know, people raised up differently. And we had, this would have been a couple months back. We had, I think, 2 gay guys at the time, and there were some potential conflicts of,
you mean with the other men that were heterosexual, gay? So you had the homosexual men that were having conflicts with the heterosexual. I think there was,
and I think they felt marginalized. They felt like, you know, not a part of, and that I think is one of the cons that I'm referring to here. Is that like it oftentimes can reinforce, like what you were saying, like you can build little cliques inside, and even if the people weren't necessarily making comments or whatever the case is, like I'm not a gay man, but if I could imagine if I were in an all male housing
with a bunch of
heterosexual men, I would feel like an outcast.
Displaced.
Yeah. And that's got to be tough.
Well, and that's why there's LGBTQ treatments facilities as well, because of this very reason. You know, this can create issues like this, and it can be uncomfortable for them. And so, you know, to eliminate that, you can go to, you know, an all women's facility, an all men's facility, an LGBTQ friendly facility, et cetera.
Yeah.
That kind of thing.
Yeah, because I have a facility in this area that I work with, and this, not that same scenario, but a scenario came in where it was a female to male transgender, and she was taking hormone replacement therapy, hadn't done any surgery or anything yet, but looked identified, looked like, spoke like, presented like a male. And it was a big issue because when he came in, they didn't know where to house the person. Do you house them with other men that could potentially, you know, there's a lot of things that could happen there, negative things that could happen there. So you could even be risking the safety of the patient in that type of home. Yeah. Or, you know, do you house him with the females, but then how would the females treat that
uncomfortable,
person?
More than likely.
Right.
Yeah, it's a tough scenario.
Right.
And that's, you know, that's why there are like the LGBTQ friendly. And matter of fact, there's one in West Palm that I'm familiar with that, you know, has a facility that's LGBTQ friendly, has housing for transgender, et cetera. And, you know, it tends to work. We've come across this scenario and really kind of having to sit down and talk about like what this is going to look like. And it's tough, you know, because you want to be able to help everybody.
Of course.
But there's so many factors to take into consideration. So,
yeah, it's tough. I mean, I think we've probably had it come across here a handful of times, and for whatever reason, it never worked out. But I don't know. I'm not going to sit here and pretend like I know what the answer is, because I don't.
Yeah.
And I get really uncomfortable whenever it's like proposed, you know, like if somebody says, hey, I have so-and-so that wants to come in and, you know, they're transgender, I like automatically just like clam up, don't know what to do. And then we go to Maya and say, what do I do?
I think that's everyone's knee-jerk reaction at this point, but it's normal.
Yeah.
You know, but...
Well, and my suggestion is always, let's get them to a facility. Let's, of course, give them a referral to a facility that's LGBTQ, you know, friendly, that they're going to feel comfortable. The rest of the clients are going to feel comfortable. There's not going to be any issues, et cetera, et cetera, et cetera. Yeah. Because we want the last thing, you know, we want to become an issue is their gender identification when they're trying to save their lives from substance use disorder, you know?
Yeah.
Right.
But I'll tell you, there's not enough LGBTQ
definitely
treatment centers. So
yeah.
So as far as the cons goes, you have here mixed opportunities. Is that supposed to be missed opportunities?
Yes.
Okay. Your handwriting's terrible, by the way.
Well, she did put mixed.
You said yesterday, oh, thank God my handwriting's nice. And it's not.
Maya, can you read my handwriting?
I can, and I was just going to say, for a doctor, her handwriting is actually impeccable. Have you ever seen my grandfather? I mean, I don't even understand how he read his own.
Is your grandfather a doctor?
Yeah.
I think you need to give me one positive comment for your negative comment. I'm ready.
Hang on.
My grandfather was a cardiologist. He was also medical director at Georgetown University for decades.
Wow.
Yeah, shout out Grandpa. He just passed at almost 101 years old last year. Yeah.
No kidding. A positive.
You're thinking too hard.
I think you're a very valuable asset to our podcast.
Thank you.
That was nice.
Yes, I said thank you.
Yeah, but like in a passive way. Like I could have came up with something
Tambini,
better.
I love your style. You are so cool.
Oh, thank you.
Yes, and not just fashion style, just, you know, your swag, if you will.
Thanks, Maya.
You're
I
welcome.
love you.
I love you
If
too.
I could have a personal therapist, I would want it to be you.
Thanks.
So there's
Should we give Tom a compliment?
no, I'm good.
I mean, it's kind of fun.
Yeah.
You look good in green, Tom.
I don't have green on.
Yeah, that's green.
I like that shirt.
This is
Isn't that a
Viore.
green? What is that?
It's green. It's
not a
forest green.
sage. It's a forest, like with a touch of sage. I
Matte
think.
green.
Yeah.
It's Viore.
We know.
Viore.
Shout out to Viore.
Shout out Viore.
Yeah.
These pants are Viore too.
Yeah.
If you didn't know, you can go to Viore.com, enter code MINDPUMP to receive 20% off.
We're terrible. This is what it's come to.
This is fun. This is fun. Cons, yeah. I mean, honestly, I don't know of a lot of cons to gender specific treatment. I think that it's very beneficial. I can't think of a reason for somebody not to go to a gender specific outside of, you just are not. I don't know. I mean, I think the vast majority of people would benefit from gender specific treatment. But, the reality of it is that there's not as many gender specific treatment options as there are co-ed.
Yeah.
And with that being said, there's definitely more male specific facilities than there are female.
That's for sure.
I went to an all-female treatment center, and it was a great experience. I wouldn't change it for anything.
Yeah.
It was so good.
I did co-ed.
Yeah.
That's where I found the love of my life for 4 weeks. All right. Well, thanks for coming on, Maya. Thank you, Dr. T. Any final thoughts?
No. I think we're going to have to edit the shit out of this podcast.
No way.
He's not editing any of this.
Yeah.
I'm not editing
I
nothing.
know.
All right. That is it for this episode of Real Recovery Talk. Thank you for tuning in. In the end, if you have any comments, questions, or concerns, you could always reach us. info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message. That is it. We will see y'all later.
Later.